We have our featured speaker this evening, Dr. Ronald Cohn. Dr. Cohn moved to Toronto 8 years ago, joining Sick Kids Hospital, first as Chief of Clinical and Metabolic Genetics. In 2016, he was appointed as Chief of Pediatrics, and since May of 2019, he has served as President and CEO. Shortly after moving to Toronto, Dr. Cohn, along with his wife, Iris, and their 3 children, joined Adath Israel and have been active members ever since. Iris is the lay leader for our Shinshini program, and Dr. Cohn serves on our medical advisory board, as well as our board of directors. And most importantly of all, he is a world-class mensch. It's my pleasure to welcome Dr. Cohn to this evening's panel. Turn the podium, so to speak, over to you.
Thank you very much, Rabbi, and welcome everyone. Let me start by first wishing all of you wholeheartedly Chag Sameach, and I hope that all of you and your family members are safe and healthy. And I'm sure that the last few days, especially during Pesach, when we're usually getting together with friends and family, were particularly challenging. And I guess the question that we ask every Pesach, why is this night different than any other night, has for sure had a whole new meaning to all of us this year. And yet I hope that all of you were able to have a meaningful Seder, or both Seder nights with your loved ones. We are currently for sure living in extraordinary times of unprecedented complexities. That's not just true for the healthcare sector, but it's in every aspect of our life. As a society, as families, and as individuals, we were forced to hit the reset button. There's not a single individual who's not affected by this pandemic, whether it's through work, whether it's through family, or sometimes both. We also live in times where news outlets and social media literally create a tsunami of information, some and most of which are helpful and informative, some not so much. So in speaking with the leadership of our shul, we decided to organize this evening to provide all of you with an opportunity to ask any question that is on your mind. And I will do my very best to answer them to the best of my knowledge. If I don't know the answer to a question, I promise if there is one, I follow up with individuals who can answer the question you have. Let me begin by first giving you a little bit of a summary of where we are today, address some of the recent developments of last week. Then I will take your questions, and then I will end with a few final thoughts for all of you. But let me first start by telling you something that I have mentioned at now several of my town hall meetings at Sick Kids. I'm largely living in Canada during this time. The collaboration that I have experienced among the entire healthcare sector in our province at all different levels. Our collaboration with government at provincial and federal level have and continue to be by and large excellent. I'm sharing this with you because I hope it is reassuring for you to know that the collaborative spirit and respect between everyone in the healthcare sector and government continues to be superb, despite a situation that is incredibly complex and sometimes changes on a daily basis. What we are currently most busy with is trying to ensure that we implement measures that keep all healthcare workers safe. And when I say all healthcare workers, I mean everybody, whether these are frontline physicians or nurses, whether these are people who are helping us clean our hospitals, our offices, to make sure that patients and families are safe, and that we keep the most vulnerable members of our society safe. The most vulnerable members of our society at the moment are really elderly individuals who have pre-existing medical conditions. There is a few silver linings, but one silver lining I want to share with our younger members, if you are here today with us, is that children do not get very sick from this disease. They can get the disease, but they don't get very sick from this. And from all the data we know from South Korea, Italy, Spain, and now the United States, children with pre-existing medical conditions are at very high risk of getting very severely sick. What we also do in the healthcare sector at the moment is we are preparing for various scenarios of increased patients needing medical care in hospitals, creating capacity in our community hospitals, in our academic health centers. And we are preparing for the worst, hoping that it will not even come close to what we are currently preparing for. Let me give you a few updates from the last few, let's say, few days. As of 8 a.m. this morning, we had about 23,000 individuals in Canada who are COVID, 7,000 people. And a number that's often a little bit ignored is we have had almost half of those people already recovered from the disease. Now I want to share some data with you that we received yesterday, and I'm going to say we're cautiously optimistic about what I'm going to share with you now. The curve seems to be flattening right now in Canada.
Excuse me, Ronnie, may I interrupt for one moment?
Sure.
We're getting, I'm sorry to do this, we're getting some feedback that the sound is poor. It's going in and out. I don't know if that means speaking closer to the microphone or not. Do you want to try that as you move forward, and then I'll let you know?
Sure.
Yeah.
So then let me start with what I would like to call cautiously good news. So we have just received model data as of yesterday that the curve appears to be flattening in Canada. And this is also reflecting the current status of our intensive care unit patients in the GTA and Ontario at large. We have to take these data with a lot of caution, but it does appear that physical distancing is having an impact at the current moment. If the current trend continues, and there's a big if still in place, then it may get significantly less bad than what we have been predicting over the last 2 weeks and what we have been tirelessly preparing for in the healthcare sector in Ontario and Canada. So let's speak about physical distancing a little bit. I know how difficult this is, specifically at times of holidays, where we cannot see our friends, where we cannot see our families. It is, however, one of the most impactful measures that we currently have under our control to keep the virus from spreading. The second important aspect of keeping the virus from spreading is no matter how fancy technology is, and no matter how many different hand sanitizers you all have in your house, washing your hands and practicing good hand hygiene is incredibly important and critical. I hope that by now all of you have washed your hands within the last 3 weeks more than usually during a year. And the second aspect of this is when you leave your house and when you touch anything outside of the house and you don't have an immediate opportunity to wash your hands, try to make sure, what has been clearly one of the most difficult things for me, to not touch your face. I didn't know how often I touched my face until COVID-19 hit us here. But if you happen to be outside and you cannot sanitize and or wash your hands, make sure that you do not touch your face. Let's spend a couple of minutes on masking. This is one of the many examples over the last few weeks how recommendations and how analyses of data change over a period of time. The current recommendation, and it is just the recommendation at the moment, is to wear a mask when you go outside. This could change into a directive, meaning it could become mandatory at some point. At the moment, it is just a recommendation. It's very important for me to emphasize, though, that you know that you mainly are protecting others from potentially getting sick. And while I recognize that there's a psychological component for us to feel protected by ourselves, you really mainly are protecting others from potentially getting the virus. I do have one plea for all of you. If you want to wear a mask, please do not wear the N95 respirator masks. These are really masks that should only be reserved for the healthcare sector. And if you do have some, there are many, many donation centers at hospitals and at government that would gladly take these masks. I thought I'm going to show you for a second what you should do and how you should wear a mask. First and foremost, before you put on a mask, which is this here, wash your hands. After you wash your hands, grab the mask at these ear lobes and then put it on just like this. Make sure that you do not touch your face when you have your mask on. When you're ready to take your mask off, you go behind your ears, unsnap it, and make sure that you realize that the front of the mask is what could potentially be contaminated. So you do not want to touch it. You want to take the mask like this, throw it in the bin or throw it in the trash can, and then again, wash your hands, please. Another topic I want to briefly talk about is, you have probably heard in the news, or you know from your hospitals or from your primary care physician, that a number of the essential healthcare services have been reduced at hospitals to only have minimal procedures happening. I do want to tell you that as of last Thursday, there is an enhanced focus locally and provincially to ensure that this does not negatively impact any kind of morbidity or mortality of patients who have non-COVID-19 related conditions. A plea to all of you, specifically the elderly who are joining us tonight, if you do not feel well, even if it's not related or one of the symptoms that you have read about when it comes to COVID-19, please call your physician and make sure that you don't stay at home in case you need to be seen, and you will be seen if you have to be seen. I am sure many of you read a lot of articles about potential treatments of COVID-19. Let me first talk about what has been mostly in the news. It's either the combination or just taking the malaria medication hydroxychloroquine together with the azithromycin or Z-Pak antibiotic. There has been one study from France in 20 patients that was initially somewhat promising. However, in any kind of follow-up study that has been conducted since then, there could really not be any significant benefit identified. On top of this, it's important to know that the combination of the malaria medication and the antibiotic puts you at a higher risk for a side effect that can cause abnormal heart rhythm. So please be careful, try not to request these medications from your physicians in case you get sick with COVID-19. There are currently 69 clinical trials all over the world looking at hydroxychloroquine and a lot of other different medications, antivirals, similar to what you can use when you have the regular flu, that are ongoing. And as soon as decent or good supportive data are going to come out, I'm sure it will have a positive impact on how we can either mitigate certain very severe cases or maybe even have certain mitigating and or protective aspects for everyone who is affected by COVID-19. And last but not least, there are currently 8 companies around the globe who are working on vaccinations. 2 of those have already started a safety trial in humans. While this is honestly almost unprecedented in terms of speed, we have to be realistic that it will take time for these vaccinations to first be proven safe. Then you have to prove that it's actually protecting you from getting the virus. Then you have to solve the problem of producing these vaccinations for billions of people. So I think Any kind of estimate that is below 1 year is completely unrealistic, and it's probably more realistic to expect that it's going to take closer to 18 to 24 months. Another question that a lot of people are often asking is whether COVID-19 is worse than the flu. It's a great question, and yet another difficult question to answer. The comparison is difficult to make because we don't know really the exact number of individuals that have been or are affected by COVID-19, because there is a significant number of individuals who have very mild or even no symptoms and are still affected. The asymptomatic population is, in a conservative way, estimated to be 25%, but there are other data suggesting that it could be up to 75% of asymptomatic individuals having the virus. So this makes it very difficult to compare. What we do know, though, is that the risk of getting aggressive lung disease, particularly in the elder population, is higher than the regular flu, and is one of the main reasons why you hear so many reports of intensive care units in New York, Italy, and Spain running over capacity, because it requires very aggressive treatment. The other reason why you hear so much about COVID-19 and why we are put into a situation of containment and self-isolation is, while the disease itself may be something we could manage, but if you take it on top of an already overly stretched healthcare system, whether that's in Ontario or in many other industrialized countries over the world, it is just too much to manage what the healthcare system is managing at a baseline, plus a pandemic that we are facing at the moment. The other comparison that is difficult to make is that, as I mentioned to you before, we don't have a vaccine. But what we do know is, we do know that the transmission rate of COVID-19 is significantly higher than the flu. So one individual who has the coronavirus can infect up to 2.5 individuals versus 1.4 individuals with the regular flu. Now, here's some additional good news, though. As of Friday, the transmission rate has gone down from 2.5 to 1.3. By the time the transmission rate goes below 1, you can begin to think about how to loosen restrictions. So we are getting close. And then the most difficult question that individuals ask me, and is I'm sure on everybody's mind, is when are we going to go back to normal life? Truth is, there is no answer to this at the moment. Having said that, I want to reassure all of you that there are many different individuals and task forces that have been formed just as of last week to exactly look what it could look like if we can and when we can begin to loosen some of the restrictions. There will not be a full switch on to normal life. It will be gradual, but we will get back. And specific thoughts are currently given specifically to how the economy is going to get back. How do we get children back to school? And what are we doing with the mental health impact on maybe almost everyone that has to go through these difficult times? I in particular have put together a small group who is going to look with government, provincially and federally, at a potential opportunity how we can open up summer camps for children, whether these are day camps or overnight camps. I do think it's important, though, to realize that physical distancing will be in place for a long period of time. And while we need to go back to normal life, and we will get back to normal life, we have to do it in a very thoughtful manner so we can ensure the safety of our most vulnerable individuals in our society. That will involve testing, contact tracing, and soon we will be able to
Hold on, Ronnie, Ronnie, we just lost you again. I'm not sure what happened. We might have to do a test. Can you just check your microphone to make sure you're not muted?
Says it's good. Can you hear me again?
We're good, yeah. Just stay close to your mic, please. Thank you.
Okay. So I don't know when you lost me. What I wanted to tell you is, when we go back to normal life, or to what I would call a new normal that we are still going to define, we have to make sure that we protect our most vulnerable individuals and that we prevent a second wave from occurring, at least as much as this will be possible. It will happen through very targeted testing, contact tracing, isolation of new infected individuals, and we will soon roll out antibody testing to check whether you actually have had coronavirus infections in the past, even if you don't know whether you were positive ahead of time. The more we continue to adhere to physical distancing and hand hygiene right now, and it's really right now, the sooner we will be able to see a significant drop of new cases. We will begin to restart our normal life. I think I'm going to stop here and start taking your questions.
Okay. So at this point, thanks very much, Dr. Cohn. At this point, we're going to turn this over to Sarah to moderate. And Sarah, just wanted to make sure that you are not muted. And I'll take you, can you also take yourself off the, put yourself back on the camera as well. I'm just going to get you to start your video.
Okay. Hello, everyone. Thank you all for being so patient with the sound and the technical side of things. We're on Zoom, but we're also on YouTube. So anyone who's watching us on YouTube, please feel free to send us questions in the comments there. So we will get right to it. So first question, where do I buy a mask?
So right now, I would encourage you to look at a various number of different YouTube videos of how you can create your own mask out of cloth material. Because any kind of mask you can currently buy is incredibly expensive. And if you think about what I told you before, that you're mainly protecting others from being infected, then any kind of cloth you can wear that you can create at home. Sanjay Gupta has a terrific video of how you can create a mask out of a bandana. There are many others. I've seen at least 12 others. It's the best way to go. That would be my personal recommendation. You have to wash this every time you take it off. If you go outside and come home, you have to wash it. So you may want to create a few, but I would encourage you not to buy any because it's incredibly expensive and way overpriced.
Okay. And can you explain some of the benefits of flattening the curve beyond overtaxing the medical system?
I think we have put the restrictions of physical distancing and closing pretty much everything in our economy down except for the essential services in order to prevent the spike of new infections. The only way for us to go back to loosening the restrictions is if the number of new cases continue to drop over a significant period of time. So it is good news, not just for the healthcare sector, but it's good news for all of us, if it continues like this.
Now, there's a few strands of this, or we've heard that there's a few strands of this. Do we need a separate vaccine for each strain, or is there one?
Truth of the matter is we don't know the answer to this. What we do know is that at the moment, from every data set we know, is that the virus mutates less than the regular influenza virus. That's not to say that it won't, that we won't need various different vaccines, but there is currently the thinking in the medical research community that maybe one vaccine will be enough.
How long can the COVID virus remain on hard surfaces or clothing?
It depends on what kind of surface you look at. I think the surfaces you need to be most concerned about are cardboards and any kind of plastic surface, and it can stay on these surfaces for up to 2.5 days.
We've had a couple people ask about the transmission rate. If people are asymptomatic and we aren't testing, how do we know if these people are passing the virus on, or are they still contagious?
It's a terrific question, and the answer to this is we don't know for sure. The current transmission rate is really based on looking in the community and knowing of people who are infected, going into self-isolation, and or contact tracing them if they have been around other people before they were tested positive. And this is the number that we are focusing on right now. The asymptomatic number of people out there is an unknown that we won't be able to tackle because we won't be able to test everyone. But we will be able to drop the cases of new infected people, and then through targeted testing, identify certain areas that may have to go into self-isolation if a smaller outbreak occurs after we begin to loosen some of our restrictions.
Now, one person is asking, if you're over 70 and things go back to normal, what does that mean? What is normal without risking your life at that age?
So I think it's a very good question, and I wish I had a clear answer for you. I can tell you, where I said this in my opening remarks, any kind of gradual return to whether it's restaurants, whether it's other work forces, whether it's schools, will have to take into account how you can minimize the risk for elderly individuals without continue to isolate them either. Because I think I'm as much worried about the mental health of children and their families as I'm worried about the mental health of our elderly population, who are now more isolated than they probably have been in a long time. So as these groups who are currently really literally started their work last week are beginning to think about how to do this in the best way, the main goal of this is really going to be how to contain a potential second wave, as well as how to protect the elderly and the most vulnerable.
Now, how do we define normal? So one person's asking, when do I get to see my grandkids again?
These are two questions.
Mm-hmm.
The first question is, how do we define normal? There will be a new normal that will be defined. And I can tell you there are a number of countries in Europe right now who are about to loosen certain restrictions, and it's Austria, Germany is thinking about it, and a couple of other countries. So we will see and learn from these countries how they do it, what the impact is on new infections, and we will have to redefine a new normal. It will be, that's why I made the comment, we won't just switch it back on. In terms of the question, when can I see my grandchildren again? I think that's probably one of the most toughest questions to answer at the moment. I do, however, believe that if we have reliable antibody testing in place, we will probably identify a number of children who already had the disease. And with this antibody testing in place as one potential solution, that could ease into a way of how you can see your grandchildren.
So follow up to that then would be, why does it seem like the kids don't seem to catch it? Why are they immune?
So with all the complexities of the current situation and all the hardship, it's a fascinating question that a number of scientists are looking into. There are a number of different hypotheses about this. The let me say, the most common hypothesis or the most favorable hypothesis at the moment is that you are actually getting sick from the disease through the immune reaction of your immune system. So it's not the virus itself that makes you sick, it's the immune reaction to the virus. And it appears that this immune reaction is significantly different and much more aggressive in adults than it is in kids. But that's just a hypothesis that's currently being tested.
Can you get it a second time? We've heard in Korea or perhaps in Asia that some people are showing signs
Well,
again.
it's really, okay, so this is a very good question because the data from Korea and China are not conclusive. We do know from a series of monkey experiments that the monkeys do not get reinfected. What we see in China and South Korea, which was just reported within the last 72 hours, it's not clear whether it's an actual reinfection or a reactivation of the virus that individuals had beforehand. We have to figure this out first, and it looks like that it's more likely to be a reactivation of the virus, meaning that these few individuals were not able to mount an immune response like many others. What the reason for this is, we have to all learn, but it's looking more likely that it's a reactivation than a reinfection of the virus.
Now turning to home life, is it safe to use hand towels, dish towels, that sort of thing to dry our hands, or is it safer now to use disposable ones?
That's a good question. I'm not sure I have an answer for this because within the healthcare setting, we are obviously not using hand towels. So I'm going to have to get back to you, and I'm going to ask my infectious disease specialist. I have to admit to everyone that we are not using paper towels right now.
Okay. Not that we can buy any anyway, because they're all sold.
Not that this is a directive or suggestion that I want to give to anybody. So you hear, this is number one question I got to follow up on. We will post the answer to this.
How do you advise washing produce, handling food around the house?
So there are various different ways of how you can do it. There are a number of individuals who don't do it at all. But I think if you want to be on the safe side, the best way to do it is that you create in your house a dirty sink or a dirty area and a clean area. And you put your groceries that you bring home into the dirty area. You take it out of your bag, you clean the surface, put it on the clean area, and once you are done taking everything out of the bag, you clean the dirty area and make it clean again.
Is it still necessary to wash your hands regularly if you're home alone or not going out of the house?
No. If you are not getting in touch with anybody or anything from outside and you're just at home, then you just have to wash your hands like you usually wash your hands.
Do you think people will be required to prove that they have immunity before returning to work? Do you see governments moving in that direction?
I don't know the answer to this. I can tell you that it's being discussed right now, and it's something that I'm personally a little bit concerned about. As much as I believe that the immune testing, if it's really reliable, is going to play a major role in our opportunity to go back to some normal life. You have to take into account that there's an unintended consequence of creating a two-tier society here. You're going to have people who run around all happy because they feel like I'm protected, I already had it. What do you do with the other people? So I think that it's yet another example how careful you have to make decisions to not have any unintended consequence of making things even worse than they are right now.
Going back to kids, if the parents are not showing signs of COVID-19, does that mean the kids are not carriers? Like if a child gets it, do the parents automatically get it?
No, the parents don't necessarily automatically get it. But similar to the children, a number of adults, specifically younger adults, don't necessarily get as sick as some of the elderly. But there are a number of studies, mainly out of China and South Korea, who have shown that if you have an infected child or two infected children, as a matter of fact, in a family, the parents don't necessarily get sick.
Is it safe to continue with home delivery of newspapers and the mail?
Yes, just wipe it clean when you receive it from outside.
Is there a risk of going for a walk outside alone? If you're maintaining good social distancing, is it necessary to wear a mask when walking alone out by yourself?
No, you don't have to wear a mask if you go outside, whether it's alone or whether you go outside with your partner or another family member. If you maintain social distancing, you do not need to wear a mask. The real key of going outside and being careful is that you really maintain the 1 to 2 meter distance from other people. If you do that, then you don't need to wear a mask.
Why does the mask only protect the virus from being shed by the wearer, but not from the virus being inhaled by the wearer? Can you maybe explain that, clarify that?
Sure. The mask itself, so first of all, let's back up for a second. The way how COVID-19 is transmitted, it's through droplets. It's through droplets of your nose, of your mouth, of your eyes. It's not an airborne transmission. I know there are a lot of discussions in social media and all over the place showing that if you speak, like our Prime Minister recently spoke about moistly speaking. So if you have a moistly voice and you tend to spit when you're speaking, then yes, you can transfect someone. And there are certain aerosols that come out of your mouth when you're speaking that contain the virus and that immediately drop. So it's important to know it's still a droplet infection. Having said that, if you wear a mask and you prevent these droplets from going on surfaces that you may get in touch with, where the virus can get stuck, and then somebody else who would come and touch the surface could get infected. That's really how you protect yourself. Now, in theory, if we are going to wear a mask, we're all going to protect each other from this. And that's why I said earlier, the current recommendation of wearing a mask may well change it to a directive like it did in Singapore and South Korea.
If a person is immune compromised, what does that mean for them going forward?
It's a really good question and a really difficult question to answer. What I can tell you is among the elderly population, about 70 and up, there is a slightly higher number of patients who get very sick who are also immune compromised. In the younger group, between 20 and 70, from all the data we are currently looking at, the risk of getting a severe infection if you are immunocompromised is not necessarily higher depending on the degree of immunocompromise you have. The group of patients who are at higher risk, no matter what age, even children, are the individuals who have cancer and have a severely depressed immune system because of cancer. All the other groups, and there are obviously a lot of people who take immunosuppressive medications for different diseases, while we treat them at higher risk, there is really no evidence at the moment to say that these are filling up intensive care units anywhere around the world.
If you have immunity, how long does it last?
We don't know.
No.
We don't know the answer to that. It's literally, if you think about that, the first cases were detected in China at the end of October, beginning of November. We simply don't know for how long immunity is going to hold. There is obviously some similarity between this coronavirus and the SARS virus from 2003. That immunity seems to be a lifelong immunity. So if there are some similarities, that could be the case, but we really don't know at the moment.
Now, is it similar to when you get a flu shot? The flu shot lasts, like how long is the immunity with that? Because if they create a vaccine for this, does it mean we'll be getting vaccinated year after year or once?
So that's what we don't know. We don't know whether the virus is going to mutate significantly enough that whatever vaccine that is going to be developed over the next year will be a one-time or like a two-time vaccine with a booster, and then you're fine, or whether you need repetitive, different kind of vaccinations. We don't know that at the moment.
In Hong Kong, people are getting their temperature taken when they go out on public transport and restaurants. Do you see that coming to Canada, and how would that even work?
So I wasn't here during the SARS crisis, but I do know that anybody who entered the hospital during the SARS times had to take their temperature taken. Truth of the matter is, at the moment, this is part of the thought process of, for example, how we're going to get kids back to school, how we're going to open up certain other areas. Should temperature be part of this or not? I'm not sure we have enough data to give you an answer. It is, though, something that I could foresee coming to Canada as well.
And then if you work in an office environment and you share papers and files, that sort of thing, how do you prevent it from spreading?
So first and foremost, you should not go to work if you have just the slightest tickle in your throat. I think that's really critical. I think almost all of us who are working know that we never ever really stay at home until we really, really feel bad. So all these rules are new rules now. You have a tickle in your throat, you don't feel 100%, you tell your work, I can't come to work. And depending on where you work in the healthcare system, anybody who doesn't really feel 100% at the moment gets tested. Now, we are going to expand this type of testing into other populations so that we can expand our testing as much as possible in the people who have minimal symptoms. Now, if you are asymptomatic at work for, let's say, a day or two, and then you become sick, is there a risk that you could potentially have infected somebody else? Yes, but this is where then contact tracing is going to come into play. So you identify an individual who tested positive. You identify the other individuals who have been in touch with that person. And then you follow those and most likely test those in order to make sure that they are not sick. That's exactly the idea behind contact tracing, trying to contain this as we move forward.
And then in the future, what preparations can be done to reduce the severity of something like this? Because we're already reopening the wet markets in China. So does this mean that, 10 years, 100 years, this just starts all over again?
Oh boy, that's a really good question. I think if there's one thing we are learning from this globally, and it's really a global problem, right? The virus doesn't know any borders, and for sure doesn't make a difference between ethnicity or anything else like that. Mm-hmm. We have to learn from what did we do right in the global pandemic response, and what did we do wrong, and then take the learnings from this into making decisions that our system is better prepared than before. I think one of the reasons why we are a little bit cautiously optimistic in Canada is Canada did experience the SARS virus and has been able to go back to some of the learnings, although this situation is about 10 times more complicated than the SARS virus, but you can go back to certain learnings. I think that the entire world is going to find a whole new appreciation for global pandemic preparedness and public health measures through this crisis.
Well, this is a very important question. If you need a plumber or a service person to come to your house, what do you do?
So if you need a plumber, you have the plumber come to your house, and the plumbers, these are currently considered essential workers. They usually enter, they are supposed to enter your house with a mask and gloves, and then you let them finish what they have to finish, and then you take your own gloves and just clean wherever these individuals have done some repairs. In general, they're instructed to clean everything after they are done, but if you want to be on the safe side, you can clean after them.
Okay. Now I'm going to group two questions together. So are people with asthma at a higher risk, and how can people differentiate between things like asthma, allergies, and COVID? You know, because it's the time of year when everybody's coughing or sneezing in some capacity. So how do we differentiate between them?
So I'm going to go with the first one because that's easy to answer. People with asthma are not at higher risk for getting severely sick. People who have severe and chronic asthma, and specifically when you get older and you have something that's called chronic obstructive lung disease, which is usually the result of having asthma for many, many, many years. These individuals are at higher risk. The answer to the question of whether you have a sneezing attack or whether you are coughing because of allergies or COVID is a really tough one. And it's particularly tough within the healthcare setting at the moment because we have people who come to work and we screen them and we ask them, how are you feeling? And they say, well, I just have some allergies. And then we test them for COVID. And then we ask them to try to treat their allergies as much as possible, hoping that the symptoms of a runny nose and or coughing are getting better. If they're not getting better, we at this point repeatedly test these people. I'm not sure it's the right thing to do, but that's the current approach. It's a really tough one. And I think the guiding principle at the moment is if you have allergy symptoms, try to take the medications that you usually take to improve those. And if these symptoms don't get better and or get worse, then for sure try to get tested.
Now, there is no SARS vaccine, is there?
No.
So why did we not require a SARS vaccine during that time, but we need a COVID vaccine now? What's the difference between the two?
SARS in 2003 was really mainly a hospital-acquired virus that really, through certain containment and mitigation strategies, disappeared. And this is going to be different. The transmission rate of this virus is so much more because it's all over the community, and it's also being transmitted in mildly and asymptomatic people, which is very different from the SARS virus. So you need for sure vaccination here.
What are your thoughts on sending the kids to camp? I'm sure some parents are just about ready now to send them to camp. So what are we going to do in a couple of months?
So, like I said before, I've put together a small group of individuals from the healthcare sector working together with government on trying to identify safe measures of how we can get children to camp all together. There are two different types of situations. There are the overnight camps that are an entirely different issue to deal with than the day camps for children who cannot go to overnight camp because they're too young or they cannot afford it. There is some very aggressive thinking happening in Ontario as well as at the federal level to identify possibilities to get children back to camp.
I've had a couple people ask about reusing masks. So not the cloth ones, but just the paper ones or the more cotton style. Can they be reused? How do you disinfect them?
You should really not reuse them.
Sarah, I'm just going to jump in. It's coming up just after 8:50, so we have about 5 minutes left.
Okay, I have a couple questions. One was, what are your thoughts on high holidays? And, will we all be in synagogue in a couple months?
I think we need to discuss this over the next few weeks and see how things are developing. And it's obviously not going to be my decision. And I know that our leadership at Shul, including our clergy, are already beginning to think about what could it look like even if we can't go back to the normal that we know of. I'm confident that our Shul is going to identify the best possible way and the safest way for us to spend holidays together in a meaningful way.
Are health workers who've been tested repeatedly included in the overall COVID stats?
Yes.
So I'll take maybe 2 more questions. If we as grandparents are isolating at home and not sick, and our grandchildren are doing the same, what is the harm of us getting together?
At the moment, because it's so difficult to control where your children really go and what they touch, it is probably the safest to still maintain physical distancing. This type of scenario will probably change soon enough, as soon as we can loosen some of the restrictions. The problem with all of these directives are, if you really think through them and if you're really carefully analyzing all of those, then the risk of transmitting anything one way or the other is probably exceedingly low, specifically if you, let's say, wear a mask and if you wear gloves and you don't touch anybody and you don't touch anything in the house. But at the moment, we really need to just restrain ourselves as much as possible.
And then what do you see, kind of building on the getting together question, what do you see happening with family gatherings such as weddings in the next few months?
These are really difficult questions, and I don't want to sit here and pretend that I have all the answers to this, because I for sure don't. I do think it will all be different over the next few months. I think until we will be able to get together in large gatherings without physical distancing, I think it will take a long time. Now, what are the alternatives in between? I think that's where our creativity at the government level, at the individual level, at the society level has to come in, of how we can potentially get together in ways that are safe, that are different, but are still safe. I think that's all going to unfold over the next few weeks and months.
So last question then. So after hearing everything you've told us tonight, and it's giving us a lot to think about, what are the positives we can take from this going forward? What should we be learning? What good should we find in this as we move ahead?
Well, it's a great question and probably a good introduction into my final remarks. But before I go there, there are a couple of really technical silver linings here that you can see. For example, that the entire healthcare system has moved towards virtual care. Somebody's joining us here. The entire healthcare sector is moving towards virtual care, for example. I also think that, and maybe allow me to come to my final remarks that will answer some of this. I'm exceedingly agitated when I read in the news that people talk about this as a war. I don't think this is a war. I don't think there are no soldiers involved. People are not fighting with each other. It's a little bit of a test for our humanity. And by and large, it really brings, I think, the best out of it. It lets us reflect on what is important in our life and let us reflect on things that we may have taken for granted for many, many years, or maybe most of our lives for some of our younger ones. And I want to end this tonight with a poem for you that I found, which I think speaks to how people try to make the best out of it. It's from a writer called Kidiomira, who I think summarizes this in the best possible way. And the people stayed home and read books and listened and rested and exercised and made art and played games and learned new ways of being and were still and listened more deeply. Some meditated, some prayed, some danced, some met their shadows, and the people began to think differently. and the people healed. And in the absence of people living in ignorant, dangerous, mindless, and heartless ways, the earth began to heal. And when the danger passed and the people joined together again, they grieved their losses and made new choices, and dreamed new images and created new ways to live and heal the earth fully as they have been healed. Let's continue to work through this together, everybody, by practicing physical distancing and good hand hygiene. Let's show support and love to each other and take care of each other. We will get through this eventually as individuals, as family, and as a family at Adath Israel. So I'm going to end this now. Thank you for joining us. I hope that you and your families continue to stay safe and healthy. Chag Sameach.
Ronnie, I just wanted to thank you very much to the close to 200 people that joined us on Zoom, and I don't have a count on YouTube yet. Thank you. It's a Sunday night, and many of us are getting ready to possibly go back to work tomorrow and have a lot of things on their mind. So thank you for joining us. Ronnie, you came to us about a week and a half ago and stepped up and volunteered to do this, and we were so elated that you did. Thanks for sharing the information you did. It's very hard to follow with so much rapid evolution of information on TV from channel to channel, and it was great to have it all consolidated here tonight. So thank you for that, and best of luck in all that you're doing down at Sick Kids as well. I just want to turn over to Rabbi Cutler for his final thoughts.
Hi, I too thank you, Dr. Cohn, for spending time with us. And I want to remind everyone to please check your Achshav and the website regularly. The shul is continuing to offer a tremendous amount of programming and outreach to our members. Sorry, got a child here. And while I'm not a doctor and I can't speak towards physical health, the clergy, I want to repeat, is here to help you with your spiritual health. I know that a lot of you are suffering in the last few weeks. I've spoken with many of you. And please don't hesitate to reach out if you're feeling alone, if you're feeling like this is getting to be a little overwhelming for you. It's hard for all of us, and we are here to support each other, and particularly your clergy is here to support you. So please don't hesitate to reach out. As we reach out to you, please reach out to us as well. Have a good night, everybody.
Okay, thank you. On that, we'll end the meeting. Take care, everybody. Thank you, Ronnie.
Thank you, Phil, for organizing this. Amazing. And Sarah, thank you so much, Sarah.
Okay, bye-bye, everybody.